So hi guys, welcome back to the series of INICET PYQ. So yeah, we are again back with a clinical scenario. Let's just see the question. So they have asked a question where the question is like, while doing a cavity preparation on the first permanent molar of a 5-year-old child, there is an iatrogenic pulp exposure causing sharp pain that subsides within a few seconds. So what will be the line of treatment? So there is a sharp pain that subsides within a few seconds, but it is on permanent molar of a 5-year-old child. So what should be the next line of treatment? So let's just see the options first. So inform the patient about the pulp exposure and continue with DPC. DPC is nothing but direct pulp capping. Okay, then extraction. Then inform the patient about the pulp exposure and do pulpectomy. And other option is don't inform the patient about the pulp exposure and continue with the treatment. So let's just see how we can go with, like, what are the pros and cons of each option so that we can arrive an answer for this question. So let's just go with option A, which is continue with direct pulp capping. So the pros can be that we can preserve the tooth structure and the function of the tooth structure. Since it is an iatrogenic exposure, the exposure will be small, and that will with direct pulp capping, that is keeping calcium hydroxide cement, there is a possibility that it will regenerate the dentin, right? The other cons, like the negative effect of this is, since it is the first molar of a 5-year-old child, the problem is that the tooth is not completely formed, that is root formation is not completed. So because of this, there is risk of pulpal inflammation and necrosis due to the exposure, right? So these are the problems. And extraction, so since it is a new tooth, right, new permanent mandibular molar in a 5-year-old child, if we extract it, there will be a space, and then again we have to do a lot of, like, treatments to restore the function of this tooth. So there will be, like, yes, there is a positive thing that there will be immediate resolution of the for the problem, but on a long term it is not feasible, because we lose a natural tooth, we lose the potential impact on growth and development of the child, right? Then the third option is pulpectomy. So yeah, pulpectomy, what it does is we remove the pulp, then we have to generate the apex of the tooth, mostly because it is a 5-year-old child. So the pros will be that the addressed exposed pulp will be, like, it will be removed, and it will be addressed, and the tooth will be preserved, right? So the cons is, like, it may require multiple visits, potential complications are present. Okay, then coming to the fourth option, that is the final option, continue treatment without informing. So this is, like, most of the people does in their college life, in their clinical life. But yeah, since in India we don't have a proper this thing law wise, like, we are getting caught. But see, it is an ethical concern. Even if it is an iatrogenic pulp exposure or a broken instrument or anything, you should inform the patient, take a consent from the patient, inform the pros and cons, what to do about it and how to do about it, and then proceed with the procedure after getting the consent from the patient. Okay, so this you have to keep in mind, being a ethical dentist, right? So yeah, so from the options given, we can come to the answer that we have to inform the patient concerning about his ethics, and also do pulpectomy, which later, if needed, we can do apexogenesis or apexification, depending upon the uh, prognosis of the tooth. Okay, so the option will be option C is the right answer, right? So if you like our video, do subscribe. And as you know, the exam is nearing. The All India Grand Mock Test series for May is already released on our website. So if you have not yet practiced, you can go register and practice once, and be thoroughly prepared and ready for the exam. Thank you.